the tumor and chemo for the cells anywhere in the body, right? And then you follow PET scanning down, there's no uptake. Now, when we talk about esophagectomy, we like to take out about 80% of your esophagus. You know, why is that? Because we think that the tumor cells can percolate in the lymphatics in the wall. So we need a good margin proximally. In addition to that, it can go in the stomach, so we take out about a third of your stomach. Now, some centers, they just go across the stomach and use the whole stomach, okay, as your conduit. So they connect the stomach to your esophagus. Now we do a little bit differently. We do use staplers, and we divide the stomach, you know, like this. You get a nice narrow tube. Okay? Why is that important? Because it gives you more margin, number one. Okay? Number two, this tube looks like an esophagus, right? It's narrow and it's long, and it can go higher in as much as you want. So this would feel is a better functional operation than if you use a whole stomach. So at the end of the day, when you have your esophagus here, you have your gastric tube. Now this dotted line is going to be here. And then you have a little bit of reservoir down here. Okay? So this allows you to function more like an esophagus, and you still have a little bit of reservoir that's below your diaphragm that allows you to have accommodate some food eventually and be able to eat like a more normal diet. So that's the operation that we do. And then we take all the lymph nodes around the esophagus.
Wonderful. Wow. That's, yes, thank you.
That makes sense.
Yeah.
So your specimen is going to be all of this here.
And that's about a third of my stomach.
About a third of your stomach, and maybe 40% of your stomach, and then 80% of your esophagus comes out.
And that'll be...
The connections are high. So
Oh, it's...
that's too high. About right there, where you pointed to your sternal notch, right here.
Other doctors that perform in other places sometimes do not do that procedure.
Absolutely, yeah.
So that's why this is...
That's why we feel that this is, you know, gives you the best option of, you know, a breast cancer operation, and, you know, and tiny incisions, and functionally we feel our gastric tube is better because it's narrow. Because could you imagine having a whole stomach in your chest? The food's going to stay there and not empty well. And you know, we don't. And how do we know that? Well, you know, patients of cancer, as we know, patients of benign disease live a normal life. Cancer patients, depending on the stage, you know, do not. So we follow patients with benign disease and see how they did, you know, over time, and you know, they empty much better, you know, with the narrow tube. Obviously, we're gonna you know, go for a cure for you. You already had your chemo radiation, and we're gonna take out whatever we can, and then, you know, hopefully you won't need any more chemo, and we'll get scans, you know, as a follow-up.
Is there quite a bit, you said did you say every 3 to 4 months, either a CAT scan or a
PET scan? Yeah.
Does it, I mean, money-wise, it doesn't make a difference, it's just that we want to get the best, so what is recommended?
Well, I think if you want to, see, a lot of those answers we don't have.
Okay.
You know, we know the economics, we know that PET scan costs more, and scan does not, but we don't know if surveying somebody with PET scan or CAT scan ultimately leads to better survival.
Okay.
We don't know that. So our approach we do here, we do a scan, then a PET CT, we alternate. Okay. I don't have the answers whether PET's better or CT. Certainly the CT is suggestive of something abnormal. We'll follow that with a PET CT right away.
Okay. Because the PET scan usually shows more.
It shows activity.
Activity.
Yeah.
Okay.
But you know, standard CT can pick up things pretty well. Lymph nodes are enlarged or look abnormal, and then that could be followed with a PET CT.
Oh, very good.
So you know, I think we don't have the answers. I think either way is fine. And you know, but if you want a PET CT every 3-4 months, that's fine too. You know,
I'll go with White Weeks.
Yeah. I would probably do a scan and then a PET CT alternate.
Okay.
And if the scan was abnormal, then do a follow-up PET right away.
So you continue to be Regan's doctor even after the surgery
Yes,
and
yes,
after
yeah.
the follow-ups
Yeah.
and stuff. Very
I think what I would suggest is that the follow-up you keep with one of the doctors, myself, Dr. Lukatich, or Joe. So I'll leave that to you, whatever you want. I'm happy to follow you there. It's no big deal. And but because then it's easier for the offices and for us, and then you have a face
Mm-hmm.
that you'll be seeing every time, and then we can discuss the case if things pop up with anyone.
Very good. How do you feel about it? Ready to go. We're so excited to have you.
Yes. It's so stress.
Yeah.
Good. I think you are. I think you're ready, and I think we should take care of it. We have to find a time and day. I think is it one next Monday or one Monday? Okay. So we're on for next Monday.
5:30 a.m.
It's date.
It's a date.
Good. All right. Very good. Any questions you have? We're here. It's knocking the door.
Okay. It was so nice. There was a house call this morning, so that was beautiful.
I can't do anything here without these the girls here, so they do a great job.
Oh, yes. Very nice.
Good. Okay. Okay. Nice meeting you. Okay. Okay. Nice meeting you. Okay. Yes. Nice meeting you.
Okay.
Nice meeting you.
Great to the Seuss.
So I'll give you all the information, just give me 1 second, I'll just get that written out. Okay?
We got signing. All right. Any questions you have? Just give them call up or just knock on the door. Okay. How to go with the moderator? Okay.
All right. Oh, for sure. Yeah. We have reason to celebrate tonight. We will
Yeah. Take care.
I was gonna say, you just wanna wait for the
That was one of the hardest parts, and that's what made coming here today so great. I think every single one of the guys is going to give me a big hug, and just so happy to see them.
No, that's fine.
We have crews down at Steelers headquarters, of course, talking to Ben Roethlisberger about his time away. What it's like going into
It's your phone. I'm just giving it back.
Oh, this is my phone is that?
What was it off the coat? So I thought it was his.
tonight on Channel 11 News at 5.
I trust mom.
I'm not you.